Hey everybody, what's up? Welcome back to another version of the pelvic PT. I'm not really quite sure what to call this yet, so we're just going to keep going with it. I think I change it literally every single time I do this. I'm going to share this to a couple of groups so that you guys know that we're on. If I haven't tagged you or you feel like somebody needs to be watching this, today we're going to talk about endometriosis. So if you feel like there's somebody who needs to be watching this, feel free to go ahead and tag them, share it, comment them so they can see this. I'm really hoping just to help as many people as we can with all of these videos. So today we're talking about endometriosis. I know a lot of you guys did vote, and I appreciate that so much. It's so good for me to hear from you guys what you guys want to hear. It was a really tight race, so it was between endometriosis and daily aches and pains. For those of you guys that were really hoping for daily aches and pains, no worries. I have you on the November docket. So today we're going to talk about endometriosis, and then next week we're going to go live with Dr. Amanda Thompson. We're going to talk about pediatric incontinence, and then the following week, the last weekend of October, we are going to go live with Dr. Taylor Reyes, and we're going to talk about fertility and labor and conditioning. Both of those are doctors of physical therapy. They're in Texas, which is where I was trained at to begin with. They're my mentors. They're my CIs. They're spectacular. You guys really don't want to miss it. I'm super excited for those conversations. But for today, hi Frank. But for today, we are going to talk about endometriosis. And before we get into it, I want to again make sure everybody knows that there's a ton of hope. If you do have endometriosis or chronic pelvic pain, there's a ton of hope for you. There's hope that we can work on your symptoms and get you to the life that you want to live. So without further ado, we're going to dive into endometriosis. This is a really heavy topic with a lot of facts. So I'm just going to be going through them all. If you have questions, feel free to comment. If there's something that you don't want to talk about live, feel free to message me, call me, text me, email, whatever it takes. I'm here to help you guys. So endometriosis, it's a condition where the inner lining of the uterus, also known as the endometrium, that tissue actually travels outside of the uterus. And I do have a couple pictures that I want to show you guys just to make sure that you know what I'm talking about. Let's see if I can get my lighting right. Okay, so this inner lining, the red lining on this picture is what we're talking about. That's the endometrium. Now with endometriosis, this lining is actually found outside of the uterus, which is what this is. So here's a better kind of overall picture. So lining of the endometrium. This is your uterus. This is a normal uterus. Over here is an ovary with actually that's an egg that's about to get taken up by the fallopian tubes. These little fingers are what grabs the egg. So this is really important that this stays nice and healthy for what we're doing. But with endometriosis, hi Bill. This is a picture here for endometriosis. Let's see, lighting, there it goes. This is the lining, that red lining that we're talking about, the endometrium that is found outside of the uterus. This is showing it on the uterus. It can be found anywhere. They've even found endometriosis in people's thumbs before. So this tissue can actually travel through your bloodstream or your lymphatic system and find other places to call home. So these little red dots are different areas of endometriosis. That's going to cause you pain. It's going to cause you symptoms. And we're going to talk about this stuff anyway in a little bit here. This is really important though, because I want you to make sure that you notice that these can be on different areas of your uterus and it can affect your fertility rates. So I actually have a little notes here, so if you see me looking down, it's because I want to make sure that I am getting you guys as much information as possible. So the tissue itself, the endometrial tissue that is found outside of the uterus, still acts like it's normal tissue that would be inside your uterus. So it goes along with your monthly cycles. So if you are about to hit your period, that tissue that's found in other areas is doing the same thing. So it's going to get inflamed, it's going to get red, it's going to get mad, and it can even potentially bleed as well into your abdomen, into other areas that it's found. Hi, Sam. So those are really important things that are going to cause you your symptoms of pain and discomfort in other areas that you're at, is because this tissue has gone elsewhere and it is following your monthly cycle. So most women that are complaining of endometriosis, it's like, oh, it's really, really bad. And then for about, 28 days, it kind of levels out and then it gets really bad again. So it is very cyclical. Endometriosis is going to cause pain. It can cause lesions. It can cause adhesions within itself and then between itself and other tissues around it. So it is really important to mention that it can be found in other areas other than just your pelvis, your hips. Like I told you, somebody found it in their thumb once, which I thought was absolutely nuts. So with endometriosis, there is no clear reason why it's occurring. We are not really quite sure why, which also means that we cannot cure it as of right now. So endometriosis is found in 1 in 10 women. But with people with chronic pelvic pain, it's actually only found in 1 in 4 of those women. So if you are experiencing chronic pelvic pain, it might not be endometriosis. There are several other diagnoses that could be accounted for with your pain. So it's important that you're listening to the rest of this video and talking with your physician about what's really going on. So common symptoms of endometriosis are chronic pelvic pain, painful intercourse, pain with menstruation, pain in your lower back, your hips, your abdomen, your groin. Infertility is a really big one for most women. And then it can also cause things like irritable bowel syndrome, pain with bowel movement, bloating, diarrhea, constipation, trouble emptying your bowel or bladder. All those things are tend to go along with endometriosis. However, you're generally not having all of them. It's kind of like a grab bag, and everybody's different. So you might have 1 or 2 of these, and then the next lady might have 5 of them, and somebody is going to have endometriosis and not have symptoms at all. So what you're experiencing is not going to be the same between you and somebody else who has the same diagnosis. So when we are diagnosing endometriosis, and I say I'm not diagnosing endometriosis, your physician is. To get an actual diagnosis of endometriosis, they need to go in laparoscopically with a camera and then also some little tweezers and look around within the areas that are causing you pain to see if there are any adhesions. And if there are these little bits of endometriosis, they're going to actually take some of that, biopsy it, and then bring it out and stage it. So there are stages 1 through 4, 1 being the least severe and 4 being the most severe. Without going in laparoscopically, they cannot formally diagnose you with endometriosis. They can, based off of your symptoms, probably MRIs, maybe an ultrasound, some blood work, they can look at all that and be like, this tends to fit this area of endometriosis, but it's not a formal diagnosis without a laparoscopic kind of surgery to see what your staging is. The staging is, once again, really important, 1 being the least severe, 4 being the most severe. However, your symptoms do not go along with your staging. So you can have a stage 1 and have way worse symptoms than somebody with a stage 4. There are stage 4s out there that don't have any symptoms at all. So once again, your severity does not go along with the severity of your staging, does not go along with the severity of your symptoms. Once you are diagnosed with this, it is really important to talk to your physician in depth about your different treatment options. We're going to go through some of them today that I found in research and through some of my discussions with other PTs that are particularly helpful. This is by no means medical advice. This is just to be used for education and for potential talking points with your physician. So, without further ado, how do we treat endo? So like I said, there's no way to cure it. So we're only treating endometriosis. We're treating your symptoms, trying to help you live a better, more fulfilling life for you guys. And once again, you need to be formally diagnosed with endometriosis for some of this stuff like the surgery to happen. The first thing we're going to talk about is surgery because it tends to be everybody's kind of go-to for how to treat endo. So the first thing is, 1, they need to do a laparoscopic surgery to stage you. And then we can start talking about doing surgery to remove adhesions that they find. This actually has a really good rate of helping your symptoms. It also significantly tends to increase fertility rates for most women, but it does not cure your symptoms. And on top of that, there is a chance of regrowth of your adhesions and the endometriosis that is found within your body. So even if you remove it, there's a chance that it's going to grow back. I think it's about 21 to 37% of women come back to do a second surgery about 2 years after their first surgery of the removal of the endometriosis. And then about 50% of women at the 5-year mark are having the surgery again to remove the endometriosis, just because there is a chance for regrowth. Hey, Jane. The next thing is, I hear a lot of people that are considering hysterectomies to help deal with their endometriosis. This is not to be done lightly. It is really important to mention that if you do have a hysterectomy and you remove the uterus, most of the time it's a partial hysterectomy, so we're leaving the ovaries and just taking out the uterus. This will not cure your symptoms. You might be taking out the source of the tissue itself, but you're not removing the actual endometriosis that's causing your symptoms. So if you are going to have a hysterectomy, you need to make sure that they are removing the actual sources of your pain and your symptoms, which would be the endometriosis lesions that are found within your abdomen or your hips, wherever they may be finding them. It is also really important to mention that if you do have a hysterectomy, you're at higher risk for heart disease as well as osteoporosis. And that just has to do with your hormones. It's an even higher risk for women that are having a partial hysterectomy before they hit menopause. Sam, what do we say? I've had several surgeries, including a hysterectomy, and the doctor said 5 years ago that it would help. That we are really coming to see that there is a really high chance of regrowth with these surgeries. I'm sorry they haven't helped you so far. Maybe some of this other stuff that we're going to talk about today will be a little bit more helpful and maybe give you some different treatment ideas other than just surgery. There is one other type of surgery that we're going to talk about, and it's called an ablation surgery. That's where they're actually taking almost like a hot poker, and they're going and finding the endometriosis within, that is causing you pain, and they're actually burning it away. Now, you cannot do an ablation surgery with a staging. So if they're doing a laparoscopic staging surgery, they cannot go and fix it. They have to be able to take out that tissue to stage it. They can't burn it. So if you burn it, you get rid of the tissue, and then there's no way to stage it to make sure it is endometriosis and not something different. I would not choose an ablation surgery because it has a really, really high rate of regrowth of the endometrial tissue. And that just tends to be because it's really hard to tell. These little bitty cells, think all the way back to biology, these little bitty cells that are foreign to that area and getting them all burnt off. So it's pretty hard, and it's really high rate of regrowth. So it's not something that I personally would be choosing for me. The next thing we're talking about is hormone therapy. And hormone therapy is particularly responsive and helpful for your symptoms. It has a really good research behind it that shows that it helps. Now, this is because endometriosis does tend to be cyclical with your hormones that occur every single month. So with hormone therapy, we're looking to stabilize the hormones within your body so that we can help bring down your symptoms and kind of stabilize them a little bit for you. These treatments do tend to be really highly effective. However, with any medication, there's always side effects and there's always risks that go up with it. So make sure you're talking with them, with your physician, to make sure that we're getting the right treatment for you. I did say that it really affects your symptoms. It does not affect the infertility, because most of the time what you're getting is some type of birth control, and that kind of really affects your fertility rates. It's just kind of how that works. So like I said, make sure you're talking to your physician and find out what's best for you. And next thing we're talking about is PT. I know you guys didn't actually think we were going to make it through a video without talking about physical therapy. So, in several studies, it was noted that 94% of women with endometriosis have painful trigger points within their bellies. So those are areas of scarring, adhesion. A lot of the times you can think about it kind of like a muscle knot. And so if you have endometriosis, 94% of women tend to have trigger points within their bellies. And then 61% of people with endo actually have a confirmed pelvic floor dysfunction. And so those are all things that I am so capable of treating, that all the pelvic floor physical therapists are specifically trained to treat. So often with pelvic floor pain, there also comes pelvic floor trigger points within the muscles that we talked about last week. If you need another picture of it, let me know. I can always throw one in the comments. So there tend to be trigger points in those muscles. You did tend to have inflammation in the pelvic floor, or in the region that has the endometriosis. And then there's also generally adhesions, whether it's from the endometriosis, scarring, or just adhesions within the fascia itself. So those are all things that pelvic floor physical therapists are specifically trained to, number one, find and then also treat. So those things are going to help you with your pain and some of the other issues that accompany endometriosis. So specifically for endo, we work to relieve your symptoms by releasing the trigger points, improving your blood flow in that area, decreasing inflammation, and releasing scar adhesions. But the important thing is that we also talk about self-treatment and make sure that you're capable of treating and managing your symptoms on your own after you're done seeing me, because I don't want you to see me for the rest of your life. I want you to be completely independent and really be able to work on this stuff on your own. I knew you guys didn't think we were going to get through PT without saying PT. So the next thing we're going to talk about is pain medications and alternative forms of treatment. Now for pain meds, most people can use an over-the-counter, so like a Tylenol and a Aleve, and really manage their pain that way. However, there are heavier types of things for pain, but that's something you really need to discuss with your physician, because like I said, there's no medication that comes without side effects or risks. So it's really something you need to be talking about if you are looking for something more than the over-the-counter medication. So the next treatments we're going to talk about are actually pretty decently represented within the research, and they're showing to have really good results for endometriosis. And that includes yoga, that includes acupuncture, stress management, and diet and nutrition. Now, all of these have been shown to help with endometriosis, but I really want to point out the stress management portion of things, because there's research that shows that if you feel helpless, if you're in pain and you don't feel like you can do anything about it, that actually amplifies your pain. So the brain kind of gets in this helpless mindset, and your pain gets worse, your perceived pain gets worse, and your symptoms tend to increase because you feel like you can't help yourself. There are several studies that show that psychotherapy and physical therapy actually significantly help to bring down that feeling of helplessness. It actually is supposed to decrease your level of pain, decrease your perceived level of stress, and decrease the actual stress hormones that are within your bloodstream just through physical therapy and psychotherapy. So those are really important things that you might be wanting to consider adding into your treatment options. The next thing, and this is what I've gotten from not only from the research but also from my mentors, is diet and nutrition is super important. One of my mentors mentioned that carbs, so eating a lot of carbs, can actually increase and affect the way your body deals with inflammation. So eating a lot of carbs can lead to a higher level of inflammation, and then also a lot of sugar. Sugar has a large effect on pain and inflammation as well. And then on top of it, endometriosis tends to be accompanied with some type of dietary issue, whether that is your irritable bowel syndrome or some type of food sensitivity. So I encourage you guys to really be talking with your regular physicians as well as whoever diagnosed you with endometriosis or is in the process of diagnosing you with endometriosis about potential blood tests to check your minerals, your vitamins, if there is a food sensitivity, so that we make sure that we really have your nutrition dialed in. And maybe we add in a nutritionist so that they can look at what you're eating and determine what's going to be best for you and your body in this situation. Like I said, it's different for everybody, so nobody's going to be the same in what they're going to need. Hi, Miss Brooke. Hi, Becky. So if you're experiencing chronic pelvic pain, like I said earlier, only like 1 out of 4 women is actually experiencing endometriosis. Endometriosis tends to be almost like an umbrella term unless you are surgically diagnosed with stage 1 through stage 4. One of my mentors mentioned that she kind of feels like endometriosis has been overdiagnosed here lately. So I really want to make sure that you're discussing with your physicians about what you're feeling, what's going on, and maybe potentially looking into something that's going to actually stage you. Hi, Amber, so that we can get you a definitive diagnosis of endometriosis, or maybe it's something different, because there are other diagnoses out there that go along with chronic pelvic pain besides endometriosis that could really account for what you're feeling and give us a better idea of what's going to help you to be treated and get you back to the life that you want to live. So remember other potential diagnoses. Remember there's tons of ways for you to treat yourself. Diet, nutrition, PT, exercise is not going to hurt you. Talking about surgeries, different things of those natures, those are all very good options for you guys. Make sure that you're really discussing with your healthcare providers. Let's get you guys to where you want to be. If you have questions, feel free to leave me a comment, message me, call me, whatever the case may be. I want to get you guys as much help as we can, and through these types of videos and stuff like this, we can talk about the different aspects of endometriosis and how we're really going to care for you specifically. If you guys need anything else, please feel free to reach out to me. I'm here for you guys. Thanks for listening. Talk to you later. Bye.